second part of our program will kick off.
I am Halima Okasha Suleiman, the National Health Fellow representing Isako West Local Government of Edo State. So, being the National Health Fellow representing my local government, I have been given the mandate to come to my community, get to know the challenges, the health challenges faced in the community, and provide solutions to them. When I got down, wow, we had lots and lots and lots of challenges. And some of them included dilapidated structures of our health centers, lack of equipment, shortage of staff. But then I had to do my part of it. And here, this is one of my capstone projects. This journey actually started as a very funny one. It started when during my engagement with the community members, somebody told me that they have a primary health center they are trying to build in this community, in the Ugeda community. And I took it upon myself to say, wow, a facility, they even had the courage to come together to build a facility. Let's see how we can get it completed for them. So I started speaking to industrial sons and daughters of the community, and I brought it up with the king of the village, and he called upon the village head of this particular community, and we discussed, we dialogued, and he said he will go back to his community to have a meeting with his stakeholders, with the community leaders of the community, which he did. And he got back to me saying the people actually said, since I'm bringing somebody to come and help them fix something in their community, they would prefer to get more classrooms for their primary school because they have limited classrooms. And when he told me, I was like, wow. And that was the period the outbreak of diphtheria was hitting Edo State. And there were confirmed cases in my local government. So I took it upon myself to say, let me go see this school to see the structures. And getting here, I only met 6 classrooms, 6 functional classrooms. And this is a school that has KG 1 to 3, that's nursery 1 to 3, and they have primary 1 to 6. The nursery 1 to 3, they are all jam-packed in the classroom, so it was overcrowding, and this avenue for diphtheria to spread. So I was like, no, let's face this first, then go back to completing the primary healthcare center. I took this to the honorable representing Esako West constituency too, the president of Honorable Abugani Akokia, and he was like, wow, this is a wonderful idea. Let's get this started. And here we are, the foundation has already been laid, and within a number of few weeks, they'll be done with the construction because they want these children to start using these blocks of classrooms this session. I want to use this opportunity to thank the president, His Excellency Bola Ahmed Tinubu, GCFR, for launching this wonderful program. It has given me the mandate to make change. This is not the only project. One of them is renovating the basic health center, the Equid Basic Center at Japan community. And I have carried out sensitization program, reaching out to primary schools, talking about diphtheria, Lassa fever, dengue fever, encouraging and telling the children the importance of personal hygiene, even teaching them the how to wash their hands, the washing of hand techniques. And I also distributed some IC materials, information.
This initiative was spearheaded by the Minister of Health, Social Welfare.
Please, I want to appeal while the video is going on that those who are standing at the back, please, we are not allowed to stand. If you can't find a seat, can we move to the overflow at the dome and take our seats, please? Thank you. No standing, please.
To go and give a prime stone project. And one of the capstone projects was this free medical outreach, which is happening right now in North Ibie axis of Esako East local government across the three communities, namely Inyegba, Istukwi, Inyakebu. What prompts me to take this outreach here was because they are underserved. They lack primary and basic amenities and health care. So, based on my need assessment, I thought it wise to bring the health care to their doorstep at the grassroots for them to access it. This outreach was done by consulting critical stakeholders in my local government. So far, so good. This community happy. My people benefit the good dividends of democracy, and no one is left out.
This is the glass that I collected today from, I'm one of the beneficiaries. So, thanks to Dr. Fatima for remembering our community, and also our president, Ahmed Bola Tinubu, for remembering our three Ibie communities, which is Imiagba, Isukwi, and Imiakebu. This exercise has been going on since yesterday, and still today, and it will end tomorrow. So, I say cheers to all the people that contributed their effort for this exercise to be able to take place.
For this part, we have been buying this part for the market now. How many price will be high quality now, please? We really appreciate for the drugs she gave to us. We really appreciate the president. We thank the president. Thank you so much. We really appreciate it.
This is not the first time. And presently today we are in Istukwi. Yesterday we did that of Imeba. So in partnership with ATM Foundation also. So we want to thank the dignitaries for bringing this health outreach to this community, especially Dr. Fatima Ahmed Abdullahi, who has been like the overseer of the project. So we thank you, everyone.
Dr. Fatima Ahmed Abdullahi, which we are able to privilege from her, that she bring this outreach for us, 3 days outreach, which we are able to benefit women, men, children, young adolescents, as I said.
Yesterday, I was so down. Dr. Fatima treated me yesterday, but now I'm so strong and happy.
We are here to
Excellencies, please shall we all rise? The national anthem, please.
His Excellency Bola Ahmed Tinubu GCFR, President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria. Your Excellencies here present, distinguished senators and honorable members here present, the Secretary to the Government of the Federation, the Chief of Staff to Mr. President, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, Honorable Minister of State for Health, Dr. Ishaq Adekule Salako, Directors and Heads of MDAs here present, Honorable State Commissioners of Health here present. I'll go straight to our people of the moment that we have here, Your Excellency, sir. We have with us our royal fathers, Your Royal Highnesses, Your Eminencies, Your Excellencies, distinguished traditional rulers and religious leaders, esteemed stakeholders in the health sector, members of the diplomatic corps, representatives of development partners, members of the Fourth Estate of the REM, non-governmental organization members here, stakeholders here present, very, very distinguished guests, ladies and gentlemen. Since the early hours of today, Your Excellency, the custodians of our culture, tradition, and faith have assembled to be part of this historic gathering, the first that we are witnessing, that is bringing to fore and engendering that they also want to be part of the renewed hope agenda for health. We therefore say that, distinguished ladies and gentlemen, today we are not merely inaugurating a summit. We are igniting a movement of social leadership for health, one that positions our revered institutions at the heart of Nigeria's health sector transformation. We are therefore translating health economics to all the improved tiers that we have witnessed since the Bola Tinubu administration. On behalf of all of us here, on behalf of all Nigerians, particularly those that are watching, And on behalf of the Fellows for Health, I'd like to welcome you, sir. It has been a moment of commitment, total, absolute commitment, for what this administration has brought to fore in the health sector. Today, Your Excellency, we have been extremely gender balanced. So I have with me Ebere Young, who is also co-comparing with me. Ebere, you'd like to take a bow? Thank you. Thank you. We're moving forward, and shortly, we'll be listening to statement of commitments by traditional and religious leaders. First, I'd like to bring on to the microphone His Royal Highness Alhaji Abubakar Ibn Umar Garba Al-Amin Al-Kanani, CFR, the Sheikh of Borno, who is ably represented by the Emir of Zawzaw, the ambassador himself, who is here, Alhaji Balamiyu. Please welcome to the microphone. Yes, please. Thank you. Can we welcome him very, very warmly? Having been a seasoned diplomat himself, but today he occupies the seat of the Emir of Zawzaw. Your Royal Highness.
Excellency, the President of the Federal Republic of Nigeria, Bola Ahmed Tinubu, GCFR, Your Excellency, the Secretary to the Government of the Federation, the Chief of Staff, Honorable Ministers of Health, Professor Muhammad Ali Pate, then the Minister of State, traditional rulers, leaders of faith, professionals across the hall, ladies and gentlemen, good afternoon to you all. Your Excellency, the traditional institution represents the closest governance framework to the people. Our authority is founded not only on historical and cultural traditions, but also on ongoing engagement with households, families, and communities. This distinctive position imposes upon us a moral obligation to promote positive health behaviors and dispel harmful misinformation and collaborate with government entities and partners in delivering life-saving interventions. On behalf of the traditional leaders of Nigeria, I wish to reaffirm our collective commitments as follows. Number one, sustain advocacy for immunization and primary health care. We pledge to utilize platforms, policies, councils, and community forums to promote routine immunization, disease prevention, maternal and child health services, and encourage timely health-seeking behavior. Number two, community mobilization and social norm change. We shall actively engage our communities to embrace vaccination, support outreach initiatives, and address resistance based on misinformation, fear, or cultural misunderstandings. Number three, we support for zero-dose and hard-to-reach communities. We commit to identifying and facilitating access to undeserved populations, including those in border, nomadic, and insecure areas, collaborating closely with health and security agencies to ensure no community is neglected. Number four, strengthening accountability at traditional institutions will contribute to the monitoring of health interventions within our jurisdiction, ensuring that services reach the intended beneficiaries and that community feedback is effectively communicated to relevant authorities. Number 5, partnership with government and development partners. We reaffirm our readiness to collaborate closely with federal, state, and local government, as well as development partners to align traditional leadership initiatives with national and subnational health priorities. Number 6, championing women, children, and youth health. We commit to safeguarding the health rights of women, children, and adolescents by supporting maternal health, nutrition, adolescent health education, and the prevention of vaccine-preventable diseases. This is the speech of His Highness, the Shehun of Borno, that I read. Thank you very much for listening. Thank you.
Thank you very much, Your Royal Highness. Your Excellencies, distinguished ladies and gentlemen, we've been here all day, and one thing I've learned is that public health succeeds when public trust is strong. Your Excellency, the next to speak to us is the chairman of Ondo State Traditional Leaders Council. He's your lover of war. Please welcome His Royal Majesty, Oba Jibade Badegain Ogunye.
Your Excellency, the President of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, the Secretary to the Federal Government, the Chief of Staff to Mr. President, Honorable Minister of Health, Professor Ali Patel, the Honorable Minister of State for Health, Dr. Salako, Kabiyesi the Onírìṣà, Ọba Ẹnìtàn, Adéyẹyè Ògúnwùsì, Ọ̀jájá II, the Emir of Zazzau, due recognition to all our traditional leaders across Nigeria, as well as our faith leaders. On behalf of the traditional institutions of Nigeria, we appreciate Mr. President for approving this engagement, the involvement of our traditional institutions and the faith leaders in the health sector of Nigeria. This is a remarkable development in our nation's development. Mr. President, we are ready to be partners in progress towards development of our nation. As leaders at the grassroots, we champion the cause of government in relation to the public health of our people. We've been doing that, and we are more charged with this responsibility, and we will deliver. Mr. President, the traditional institution is not only natural, but very foundational towards societal development. Whatever that it takes on our part in moving Nigeria forward, particularly in this primary health, is so important because the beneficiaries are the people at the grassroots. They are our people. We engage them daily. On this program, under the leadership of the Ministry of Health, we will be more engaged. We are ready to serve and to continually give leadership to Nigeria and to our people. Nigeria is moving forward. After security, I think the most important aspects of life is food security and health. This program has taken the two parts in relating to nutrition. Nutrition and health in combination. So it's a policy in the right directive. On behalf of the Traditional Institution of Nigeria, Mr. President, under your leadership, once again, we thank you profusely from the depth of our heart for our involvement in moving Nigeria to the next step in relation to health and other human capital development. Thank you, Mr. President, for this initiative.
Thank you very much, KBSC. Your Excellencies, very distinguished ladies and gentlemen, we're moving on with the statement of commitments by traditional and, of course, religious leaders. Our next speaker is His Royal Highness Meibade Alhaji Abubakar Umar Suleiman, OFR Emir of Bade. Please, let's welcome him very, very warmly.
Assalamu alaikum. Your Excellency, the President of the Federal Republic of Nigeria, Ahmed Bola Tinubu, Your Excellency, the Secretary to the Government of the Federation, Chief of Staff, Your Royal Highnesses, Your Excellency, permit me to stand on the existing protocol earlier established. But allow me to mention one person that has been behind the formation of Northern traditional leaders on primary health care, Dr. Mohammed Ali Fateh. When he took the mantle of the ED, the National Primary Health Care, he formed this committee in order to eradicate polio. Then the figure has risen to almost 1,000. After the formation of this committee, the figure reduced within 1 year, less than 100. We thank the federal government of Nigeria for doing everything to make sure that health is wealth, and a healthy nation is a wealthy nation. There was, when the formation of this committee, Jigawa Declaration, and we committed ourselves to making sure that eradicating polio and other 6 killer diseases. Our commitment remains ever, and we remain committed ever before. We will do our best to make sure that the health sector receives the best, and we are committed. And you know, government and the tradition is a link between the government and the people. We thank you very much. May Allah bless Nigeria. May Allah bless the President. Wassalamu alaikum.
Thank you very much. Your Excellencies, distinguished ladies and gentlemen, this event has been an eye-opener for me. It has shown that providing health for Nigerians is not a national program, but it is a national covenant. And one person who I think agrees with this is His Royal Majesty, Igwe Ambassador Dr. Lawrence Okolio Chikezie Agubuzu, ONCFR, is a Ogunechendu of Ezemaulo Kingdom. Your Royal Majesty, I welcome you.
Nigeria, President Bola Ahmed Tinubu, GCFR, the Secretary to the Government of the Federation, distinguished Senator George Akume, Your Royal Highnesses, Your Royal Majesties, I want to end the protocol here. Your Excellency, we have come to Abuja today, and we've seen the crowd. The only thing I can remember is when President Jonathan was president of Nigeria, he called the 2014 National Conference, and the hall used to be full like this. But this one is fuller. There are more people. So you have scored a first. by bringing the largest crowd to this place. We've been committed to the health of our people. But having come now to Abuja and listened to Professor Mohammed Pate and his team, we are now more committed. So the traditional rulers of Nigeria will now go home and work harder than before. But I must tell you, Mr. President, that personally, I don't feel very happy because you were not here in the morning. There were several speeches. We listened carefully. I listened to the opening address by His Imperial Majesty, the Owner of Ife. And he was gingering all of us to work as a family, to work as a team, to see Nigeria as one. And then I felt maybe this is good. But when you look at it, this same Imperial Majesty is arranging to confer a very high honor on Sunday Igboho, who in my own part of Nigeria in the southeast, we see him as a counterpart of Nnamdi Kanu. And my brother, fellow royal father, the Imperial Majesty, does not seem to understand the pain in my heart when Nnamdi Kanu is in Sokoto. So, sir, the ball stops on your court. this man out. If we don't want him in Nigeria, return him to Kenya or London, where they took him from. You see, some of us here are being asked to go and work, but the young people in the Southeast are so agitated. They can even beat us. They see us as sellouts. We come to Abuja, they may think we come to collect money. And then we keep quiet. So, sir, please do something about this. Do something about this. We cannot make progress in this country if we don't tell ourselves the home truth. There's no way. There's no way. Now, again, they were talking about Southern Traditional Rulers Committee on Health. And the eminent professor Patel was saying that this will become an annual event, what we are doing today, if I heard him correctly. The truth of the matter is that there's nothing like Southern Traditional Rulers Council. If you come here at party and you give money to people on that basis, it's not correct. The South is not the North. We have our system. We need unity in diversity. So that people, so if you want to deal with us in the Southeast. If you have resources for us, give it to us. Don't give it to people who come and say, we are Southern Traditional Rulers Council. Democracy is a representative government. And anybody who goes to present himself without his people is not democratic. So get it. We think that we will do our best. Mr. President, we are going to support this health. Do all we can, but please listen to our cries. May God bless all of us.
Thank you very much. He has a PhD, he's an ambassador, he's a royal father. Your Excellency, distinguished ladies and gentlemen, this is the final statement of commitment, and this will come from Alhaji Rasaki Oladejo, Deputy President General South, Nigerian Supreme Council for Islamic Affairs. All right. Let me welcome the President of CAN, the Most Reverend Daniel Chukwudumebi Oko.
Excellency, the President of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, the Honorable Coordinating Minister for Health and Social Welfare, our own Dr. Ali Pate, Excellencies, Your Eminences, Your Majesties, Your Highnesses, and all the traditional rulers and religious leaders here present. Distinguished ladies and gentlemen, I bring you greetings from the Christian Association of Nigeria, and I would like to, on behalf of the Christian community in Nigeria, appreciate our President, Bola Ahmed Tinubu, and his dear wife, the First Lady of the Federal Republic of Nigeria, distinguished Senator Oluremi Tinubu, CON, for the attention that they have given, special attention they have given to the health sector since they came into office. I've been invited to events to this place, but I will tell you that 90% of the events I have attended here representing the Christians in Nigeria were on the issues that bordered on health and social welfare. It has been said many times that a government that wants to succeed must be closer to the people. And a government that will succeed is the one that listens to the people and addresses the concerns of the people. And I think that our president and his dear wife and all his cabinet members are working very hard to address some of the concerns that are being raised by the people. I want to especially appreciate you, Your Excellency, for your doggedness and your commitment to the well-being of the Nigerian people. May I use this opportunity to also commend the efforts of the Coordinating Minister for Health and Social Welfare, Dr. Ali Pate. Dr. Ali Pate has been around. He's been involved in issues of public health in this country for many years. And I can't remember seeing him telling people that he was on holiday. He's always working, traveling. If I don't see him in Nigeria, sometimes I see him at airports, traveling, and as he is moving, he'll be looking at his phone. He's not watching social media. He's actually doing some work to improve the lives of Nigerians. I can tell you that. So he is a committed professional, and I can tell you that Nigerians, and indeed the Christian community, are happy and are proud of you. So we thank you for your commitment towards improving the health of Nigerians, and this is evidenced in the numerous consultative meetings you have convened since your assumption of office as the Honorable Minister of Health and Social Welfare. Your interventions in the health sector are beginning to yield the desired fruits. And one of the unique contributions you have made in your own time is to always bring people, stakeholders together, to agree at every point as we are progressing. And this is something that should be emulated by other sectors when it comes to issues that actually border on the lives of the people. And this is very commendable. The theme of this summit, the role of traditional rulers in advancing the renewed hope agenda for the health sector, speaks directly to a truth we all recognize. Health reform is not merely a technical or administrative undertaking, it is moral, social, and collective responsibility. Nigeria continues to confront serious health challenges, maternal and child mortality, outbreaks of preventable diseases, gaps in routine immunization, and uneven access to quality primary health care. Yet, we know that these challenges are not solely the result of insufficient infrastructure or personnel. Often, they are shaped by trusts, beliefs, cultural norms, and community accountability. As religious and traditional leaders, we occupy a sacred space of trust. We ought to have the trust capital. We speak into the hearts of our people every day and every week. We preside over rites of passage. We guide conscience. We help interpret public policy in ways that resonate with faith and culture. Therefore, we cannot stand at the margins of health reform. We must stand at the very center. The Nigerian Health Sector Renewal Investment Initiative and the Health Sector Renewal Compact represent bold and structured efforts to reposition our health system towards universal health coverage. But policies signed at the national level must be translated into informed decisions at the household level. A mother's choice to attend antenatal clinic, a father's consent for immunization, a community's willingness to report an outbreak early. These decisions are influenced significantly by the voices people trust. And I want to believe that the voices people trust are the voices of traditional rulers and religious leaders in our communities. We have seen the power of this partnership before. Nigeria's journey to being certified wild polio-free in 2020 was not achieved by the government alone. It was achieved through collaboration, through the engagement of traditional rulers, faith leaders, and community influencers who countered misinformation, addressed resistance, and mobilized their people. That experience provides a strong precedence for what is possible when social leadership aligns with public policy. Today, as we continue to guard against circulating variant polio virus and other public health threats, we must extend that same model of engagement beyond immunization to maternal health, nutrition, disease prevention, outbreak preparedness, and primary health care utilization. I'm happy that earlier today we had the First Lady talk to us about the food bank and her passion to make sure that food gets to the people that need the food, not the people that don't actually need the food. And we all must commit to the distribution of food that is made available down to the grassroots level so that all of us will have a sense of inclusivity and we will all be happy as a people in this nation. The church in Nigeria, Your Excellency, is ready to play its part. Across congregations, we must continue to promote accurate health information and counter harmful misinformation. encourage early health-seeking behavior and immunization uptake, support maternal and child health initiatives, partner with government and health agencies in community mobilization, provide platforms for dialogue, accountability, and feedback between communities and health authorities. We also encourage structured follow-up beyond this summit. The resolutions and commitments made here should cascade through establishment leadership platforms across various congregations, kingdoms, community associations at state levels, interfaith councils, and traditional institutions, so that this summit becomes not just a one-day event, but a sustained movement. Your Excellency, dear brothers and sisters, distinguished ladies and gentlemen, let this summit send a unified national message. Health reform is not government's business alone. It is a shared covenant between government, traditional institutions, faith communities, development partners, and citizens. On behalf of the Christian Association of Nigeria, I pledge our continued partnership in advancing the national health agenda. Together, with sincerity of purpose and unity of action, we can build a healthier Nigeria where every child lives, every mother strives, and every community is empowered. Thank you very much for your kind attention.
Thank you very much, President of CAN, and essentially an intrusive, total, absolute total of collaborative efforts is what will take us to the promised land when we speak to the health sector. We're moving on now, and because diseases don't have borders, so every voice must be heard. Please welcome with me Alhaji Razaki Oladejo, Deputy President General, South, Nigerian Supreme Council for Islamic Affairs.
Your Excellency, President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of Armed Forces of the Federal Republic of Nigeria, Secretary to the Federal Government, Chief of Staff, the Honorable Minister of Health, Professor Ali Pate, Your Highness, Your Imperial Majesty, Onirisha, the Onion of Ife, Your Highness, Emir of Zazao, distinguished religious leaders, ladies and gentlemen, on behalf of the leadership and members of Nigerian Supreme Council for Islamic Affairs, I bring you warm greetings of peace and goodwill. Assalamu alaikum wa rahmatullahi wa barakatuhu. The Nigerian Supreme Council for Islamic Affairs, NSCIA, is the apex Islamic authority in Nigeria, established in 1973 to cater for, preserve, protect, promote, and advance the interests of Islam and Muslims throughout the country. We commend the government of President Bola Ahmed Tinubu and partners for the health sector renewal Investment Initiative under the leadership of the Coordinating Minister of Health, Professor Mohammed Ali Pate, CON. This effort is very important for the future of our nation, Nigeria. Good health is essential for our people to live productive and meaningful lives. Islam teaches us that protecting life is a sacred duty. Therefore, supporting health care is not only a government responsibility, but also a religious and moral responsibility for all of us. The Nigerian Supreme Council for Islamic Affairs wishes to assure you of our full support and commitment to the advancement of Nigerian health sector renewal and reinvestment initiative. We commit to continue using our mosque and other platforms to educate our communities on healthy living, maternal and child health, and the importance of seeking proper medical care. We will also help to address misinformation and encourage our people to cooperate with health workers and health programs. We commit to continue supporting community health efforts, especially those that serve the poor and vulnerable, Muslims and Islamic organizations. Establish and operate numerous health facilities such as hospitals, clinics, and laboratories, including health advocacy programs across the nation. It is therefore repugnant to accede to any public MOU that relegate Islam and Muslims to a second fiddle. With assurance of inclusivity, we shall not hesitate to support the implementation of the MOU between Nigeria and United States of America. We stand ready to engage and effectively support the implementation MOU to increase equitable access to quality health services and a more resilient health system. Distinguished leaders, religious and traditional leaders are trusted by the people. We must use our influence to support this initiative and encourage our communities to embrace it. We stand ready to work with the government and all partners to ensure the success of this important program. May Almighty Allah bless our efforts and grant good health to our nation. Wassalamu alaikum wa rahmatullahi wa barakatuh. Thank you.
Thank you very much, sir. Your Excellencies, distinguished ladies and gentlemen, it is said that the hospitals treat diseases, but it's actually leadership that prevents it. And those leaders are the people in this room today ready to work for the nation. Your Excellencies, our final voice of commitment will be coming from the representative of Dr. Matthew Hassan Kuka, the Catholic Bishop of the Diocese of Sokoto. I'd like to welcome here Reverend Father Maurice Kwaranga. Reverend Father Maurice Kwaranga. Okay, that's him. Just find space somewhere. It's a long trip, but he will get here.
President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, the Secretary to the Government of the Federation, our brother, Sir George Akume, the Minister of Health, Dr. Pate, Your Royal Majesties, and all invited guests. On behalf of His Excellency, Most Reverend Dr. Matthew Hassan Kuka, the Catholic Bishop of Sokoto Diocese and the founder of the Kuka Center, I read, "The health of humanity has been our mission. Jesus said, I have come that they may have life and have it to the full." John chapter 10, verse 20. Our landmark contributions and footprints to health are everywhere. During COVID-19, the Catholic bishops placed its entire health facilities of over 500 hospitals and clinics at the disposal of the nation for free. Our hands of solidarity are still stretched. Thank you.
Thank you very much. A good close-up to the series of statement of commitments that I've heard from the traditional and religious leaders. At this moment, Your Excellencies, all very distinguished ladies and gentlemen, when he had the dream to ensure that traditional and religious leaders are integrated in promoting healthcare delivery service, long time back, over a decade, we didn't know that it's something that will crystallize into what we're watching here today. It is with that sense of commitment, that sense of getting things done, that I invite most happily and proudly the Honorable Coordinated Minister of Health and Social Welfare, my own brother, Professor Mohammed Alipte.
Thank you, Auntie Moji. Your Excellency, the President of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, His Excellency, the Secretary to the Government of the Federation, Senator George Akume, the Chief of Staff to His Excellency, Mr. President, Honorable Ministers that are here, our Royal Fathers, Royal Majesties, Eminences, our Lords, spiritual and temporal, other senior government officials, distinguished ladies and gentlemen, our National Health Fellows that are here. May I, with your permission, Your Excellency, stand on the existing protocol, given the want of time. Let me first thank Your Excellency for your wisdom in directing us to convene a dialogue between traditional religious leaders and the health sector to look at the progress that we have made, look at the challenges, and where we can go forward to improve things. So thank you, Your Excellency. We have delivered what you have directed us to do. I also want to thank you for your wisdom
in using the health and social sectors as one more element within the context of your renewed hope agenda to unify this country, to heal it, but also potentially to inspire it. That is exactly what your administration has been doing over the last 3 years. To heal, not physically, but also really put healing of the pain that Nigerians had been suffering from. To unify, because the breadth of this country, the diversity of this country is all coming together across all fault lines to talk about something that is common to us, which is health. And to inspire, because by using health and what we are able to achieve, we are having more confidence as to what Nigeria can be able to do. So thank you, Your Excellency, Mr. President, for these amazing steps that we have taken. Today, we have been blessed by Her Excellency, the First Lady, who opened this summit. And we have had extensive deliberations across various themes on nutrition and the food bank, on the progress of the Health Sector Renewal Investment Initiative over the last 2 years, primary healthcare expansion, training of frontline workers, expansion of health hospital capacity that are still ongoing in all the geopolitical zones of this country. And the data was presented. Immunization, multiple micronutrient supplements, cancer infrastructure, and so many more. Thanks for your leadership in terms of policy direction, but also in allowing us to execute all of those efforts. We have had a dialogue with Royal Highnesses and our religious leaders that are here. As you can see, Christian and Muslim faiths were represented to hear their feedback. And I think we have carried some important lessons from what we have heard from them. This is a dialogue, and we've opened the chapter of that dialogue. We have used the 2025 State of Health report, State of Health of the Nation report, as the basis for the dialogue. As we had done in 2024, we shared our report card of what we had done between 2023 and 2024. Today, we also have the 2025 Health Report, the State of the Health of the Nation report, which summarizes all that we had done between federal government, states, local governments, private sector, civil society, and every facet, including our religious and traditional leaders. And Your Excellency will present that to you, but we also present it to Nigerians, because that's the accountability that you demanded, and that's the accountability that we are delivering. It's a collective effort. Your Excellency, there are various conversations that have been had, and I do hear very clearly the Northern Traditional Leaders Committee has been in existence for 17 years now. There is still dialogue that needs to be had in terms of how we approach the different facets of our country in terms of engagement. But the fact that we have this dialogue, the fact that we've opened the door, I think is the first important step that we will continue to find ways to build on it. My task here is to summarize what we have done. And I will propose what I hope the audience, including the National Health Fellows that have listened, if we agree, then we take that as a takeaway from this conversation, so that it's not just talk, but that we carry something that we will move forward with. And I will read the proposal for an Asokoro Declaration on Health in 2026 that says, we, the participants at the first National Traditional and Religious Leaders Summit, convened at the State House Banquet Hall, Aso Villa, on the 17th of February 2026, at the invitation of His Excellency President Bola Ahmed Tinubu and the First Lady of the Federal Republic of Nigeria, Senator Olusegun Tinubu, to deliberate on our collective role in advancing the nation's health and well-being. After due deliberations on the state of the Nigerian health sector and our vital role as leaders of our communities, we declare as follows. Whereas His Excellency President Bola Ahmed Tinubu unveiled the Health Sector Renewal Investment Initiative on the 12th of December 2023, followed by the signing of the Health Sector Compact, as well as the expanded compact in 2025, demonstrating significant political commitment to achieving universal health coverage. Whereas Nigeria is beginning to show progress in key health indicators, we recognize that substantial and sustained effort is required to accelerate progress towards our national health goals, particularly in the areas of reproductive, maternal, newborn, and child health and nutrition. We hereby, one, commend the federal and state governments for embarking on the ambitious Nigeria Health Sector Renewal Investment Initiative and for the inclusive spirit of the Health Sector Compact. We particularly appreciate the government of Nigeria under the leadership of Mr. President for the renewed focus on health and recognizing the indispensable role of traditional and religious leaders and institutions in national development. We commit ourselves to actively support and promote access to comprehensive range of essential health services within our communities, including immunization, HIV, TB, malaria, treatment and prevention, comprehensive maternal neonatal care, emergency obstetric services, and nutrition, including the food bank. We pledge to welcome and provide robust support for the frontline health workers and the national health fellows that are being deployed to our communities, ensuring that they are integrated and enabled to perform their duties effectively. We also advocate for and support the enhancement of healthcare quality by promoting the upgrade of primary healthcare centers, supporting facility accreditation, and participating in community-level demand generation and monitoring of facility service quality. We also encourage the multi-sectoral actions to address the social determinants of health, with a special focus on nutrition, clean water and sanitation, hygiene, and the education of the girl child as foundational pillars for a healthy society. We support the integration of accredited civil society health facilities into our local health systems and referral networks to expand access to quality care for all, including the most vulnerable populations. We will not exclude any population. Any faith-based group will not be excluded. And we call on the federal government to maintain the open dialogue and strengthen community engagement at all levels, ensuring that the voices of the people are central to planning, reiteration, and implementation of health policies. We also commit to fostering community participation in public health security by supporting disease reporting and surveillance, promotive measures, and mobilizing communities for rapid and effective outbreak response. We also call on all Nigerians to embrace the principle of shared responsibility by participating, advocating, contributing to mobilize domestic financing for health through expanding risk pools and health insurance schemes, which are critical for sustainable healthcare delivery. We promote the adoption of climate-resilient health practices within our communities and advocate for health facilities that are environmentally sustainable and prepare for health impacts of climate change. We call on the government to assign a dedicated liaison officer, which Your Excellency, we will appoint in the Ministry of Health and Social Welfare, a dedicated liaison officer that will relate in a systematic way with religious and traditional leaders. This is beyond the Northern Traditional Leaders Committee, which has existed for 17 years, but elevating that at the highest level, given the direction that you have provided. And we recommend that this National Traditional and Religious Leaders Summit on Health be conducted annually to sustain the momentum, to continue the dialogue, provide feedback, review progress, and always renew our collective commitments towards building a healthier Nigeria. We affirm our unwavering commitment to the health and well-being of our people and pledge to work in close partnership at all levels of government and other stakeholders to build a healthier and more prosperous Nigeria for all, in line with the Renewed Hope agenda. Your Excellency, this is an attempt to reframe all the commitments that we have had and the consultation with a few of the key actors to say that that is the summary of what we're taking from this summit. Your Excellency, thank you once again, and I will be glad to present the health report to Your Excellency. Thank you, sir.
The Honorable Minister presenting the report to His Excellency, the President of the Federal Republic of Nigeria. Your Excellency, the President, you are in a room where we have our revered royal fathers and fathers of faith. When you speak, behaviors change. When you counsel, families respond. When you endorse, communities mobilize. In moments of uncertainty, people seek science, but in moments of doubt, they seek you. And public health succeeds only where trust exists. So today, Nigeria strengthens that trust. It's on that note that I welcome the father of the nation, the President of the Federal Republic of Nigeria, His Excellency Bola Ahmed Tinubu.
Thank you. Please. Please. Thank you very much. Our respected royal fathers and the conscience of our nation. Thank you. The Secretary to the Government of the Federation, Georgia Akuma, all the members of the Executive Council here present, our dear royal fathers, Your Eminence, distinguished religious leaders, the leaders of our faith, the conscience of the nation, captain of industries, distinguished earth fellows all over Nigeria. All other government officials. To our royal fathers, my presence here is to give meaning to your gathering. The war against preventable diseases is the responsibility of all of us Nigerians. And I'm here as a leader to respectively say that the responsibility is yours as the traditional rulers. We've listened to this statement of commitment. It is a great honor for me to have listened to you carefully, making this commitment to improve the health quality of Nigerians your domain. I've listened carefully and I've worked with the Honorable Minister, Coordinating Minister for Health, Professor Mohamed Ali Pate, to say thank you in the presence of all Nigerians here present. For team leadership that you have demonstrated, quality leadership, commitment to duty, and efforts to get Nigeria healed. We will not let you down. You are doing a good job. Today in this hall, we have an intergenerational, institutional, and interfaith gathering, a meeting of wisdom, faith, courage, youthful energy. The gathering in itself is a symbol of Nigeria we are building. Inclusive, united, and committed to renew the hope of our people. The key word here is hope. Nothing is achieved that is for good without a hope. And we pledge that we will do everything possible. I refer to November last year during the Health Sector Joint Annual Review. We expanded the Universal Health Coverage Compact to include traditional and religious leaders, civil society, and the private sector. Your strong presence here today underscores a key truth. No health reform in Nigeria can succeed without you. You are trusted voices, bridging the government and the people, interpreting national policy and serving as moral anchors. Your engagement is central to the actualization of Nigerian health sector. Renewal investment initiatives will recognize that the sources of our goal, saving lives, reducing physical and financial pain, and producing quality health for all Nigerians depend on your leadership. You have remained steady in sustaining the trust of your subject, bridging clarity, faith, and assurance in the face of misinformation or fear. This, for us, is a great opportunity to leverage to strengthen the health of our people. Thank you for being a stabilizing force, our national development effort and traditional conscience. The Traditional and Religious Leaders Summit on Earth is deliberate and strategic. It is the foundation of a new national alliance for health that we want to foster, because the government cannot achieve the goal of reform alone. We're asking for your partnership. One, to strengthen maternal and newborn health, because far too many mothers and newborns die from preventable causes. Two, improving immunization outbreak response because communities listen to you before they listen to the government, and you are often the detectors and responders of any epidemic. Strengthening nutrition and food security, because you can impact household daily decisions, rally the community to participate in social actions to avert food insecurity and ensure that support reaches the people who need it most. We want to achieve cultural reforms. Appreciative of your commitment here today. You have the support of this government. You have the commitment. The state government are your subjects too. Call them back home. Work with them. Work the local government, including councillors. The head fellows here present, we work well with you. Let's find solutions to areas of conflicts. Respect each other's cultures and the value we believe in. We can move Nigeria forward greater and faster. And we can achieve the goal. It is in your hand. We are working with the state governors, local government, chairmen, and other partners to aggressively improve functionality of our primary health care facilities across Nigeria. Check the ones in your area. Send a message out there to look at that neighborhood or health facilities. And if they don't exist, write to the local government, write to the state government, write to us. We will respond. If we don't do it now, nobody will do it for us. That's why you are here. We want to make sure that we have the result that's necessary to care for our children. I heard that you've touched the most important foundation of malnutrition, food bank, and other areas of challenges this morning. Mine is to give assurance to you that we will do it with you. Where it's lacking, we will expand emergency transport and ambulance services to ensure Nigerians receive timely care when they need it. And last year, we introduced the National Health Fellowship Program, meritoriously selecting the brightest young Nigerians from all 774 local governments to serve as embedded system operators. They are here, ready to do the job with you. If what one demonstrates that frontline talents and passion are transformative, I am proud of their contribution to national development, including improved coordination, enhanced data usage, and fight against maternal death and childhood illnesses. Campaign against drug abuse and restoring help in health services is also included. So the fellow cohort 1, I want you to reaffirm the promise that I made to you. We are working to secure your career paths through federal structure and support from development partners. I'm also aware that Honorable Coordinating Minister of Health and his team have requested the state government to host a fitting graduation ceremony for you in your states. As you complete your fellowship, I thank you on behalf of a grateful nation and urge you to carry the spirit of altruism with you because it will bring great rewards. To cohort 2, you are the driving force that traditional and religious leaders will count on to fulfill the commitment they made today. As the operational backbone of this National Health Alliance, bring structure where systems are weak, data where decisions lack, clarity, and energy where communities seek hope. You are the youthful force behind Nigerian health transformation. The National Health Fellowship Program represents a new Nigeria where talent and competence help you reach your full potential. This administration recognizes and believes in the potential of our youth. Will we harness your energy to fuel our renewal and create opportunity that provide you with dignity, purpose, and pathway to leadership? Today, I stand here with pride. Pride that our young people are proving yet again that Nigerian future is not something to fear. It is something to look forward to. To the Federal Ministry of Health and Social Welfare, state government and all our partners, I thank you for keeping this vision alive. Thank you for your service to our dear country. As I conclude, I affirm my belief that this gathering will usher in a new era of health and honor for our people. To our traditional rulers and religious leaders, your influence is vital. Today's reform. We honor and we need you. To our health fellows, serve with honor, humility, and courage. The nation believes in you. To the generality of our people, the challenges of terrorism, I must comment on this before you. Thank you for your collaboration. Thank you for your being informative. Thank you for your perseverance. The economic reform going on is yielding good results. Nigeria is out of the dark tunnel in macroeconomic prosperity. The challenge of banditry and terrorism will be defeated with your cooperation. We are working around the clock, engaging all possible partnerships. We will win the battle. Thank you very much. May God bless Nigeria. God bless all of you.
Thank you, Mr. President. Can we all please put our hands together for the reassurance, for the integration promised, and what I will take home is the fact that it says Nigeria will be better and be greater. Again, our hands together. Thank you, Your Excellency. At this moment, Your Excellencies, all very distinguished ladies and gentlemen, thank you, Mr. President. Can we have a shout out from the fellows for Mr. President? We want to